It's October 19th. I am Mark Stewart. I want to talk about health coverage, insurance, health care, all pretty much the same thing. Whether it's from the federal government or state systems, the question about who is more likely to opt out when you give people a chance to not pay and not have the advantage of a system. Most people instinctively say, well, only the most healthy people will do that. I contend that everyone is equally tempted to do that. And in fact, if your health care is adequately covered as a relatively sick person, but with a voucher that covers most to all of your costs, you're actually more likely to opt for private care. Here's why. Private care is better. You're not subject to bureaucratic decisions. You're not subject to delays, cost codes. You're not subject to what other people decide is the proper treatment for you. Private care puts everything in your control, or if you're so diseased and mentally impaired that you have a conservator, somebody can look out for you. The private route is going to be more opted for. Let's say you're actually a healthy, about to deliver mom. You want the best for your baby. Equal cost? You're not going to a government hospital. You would rather be in a private center for the sake of your baby's health and maybe even your own. Let's say you are quite aged, have potentially surgery that can correct a disability or maybe leave you worse off. Where would you rather put your trust? Government-run system or private hospital? Almost everyone will opt for the private hospital. They don't want to lose their limb when they have the chance that with better care, they'll preserve it. And how do we know this? The Veterans Administration has lately got its act together. They've given veterans the choice. Go to the VA hospital or go to other hospitals. Cost is the same. The answer has been overwhelmingly to other hospitals, even when they actually know their doctor at the VA. They might be even closer to the VA. I like the VA. My dad used to work for the VA. But ladies and gentlemen, the VA is part of a system, and systemic care isn't as good as individualized, more nimble care. The VA's tragedies have been a result of single payer. I mean, that's what they were up until 2015 for soldiers. They were the only choice if you expected the government to care for you. And look what happened. Men died because of bureaucratic decisions. Let me apply it to Connecticut. The epitome of state-run health clinics is Whiting. That facility in Middletown, where 10 nurses so far have been indicted for beating, torturing in some ways, one patient. Now, whatever this poor guy did, he doesn't deserve it. And it was 2 of those nurses were supervisors. So with supervising and oversight above it, nobody put a stop to it until there was one whistleblower. That doesn't happen in private clinics. That doesn't happen. If you're forced to go somewhere, you have no choice. If a hospital is bad or a private clinic for this really isn't up to snuff, at least you have the choice to avoid it. When you have a locked-in government system, you don't have a choice. You're subject even to death panels. Now, to be fair, death panels, which I define as administrators who make decisions about your health based somewhat on costs. That happens even with private HMOs. However, you have a choice. And with the ratings of this HMO is very liberal in the treatments it allows, that HMO is very stingy, your choices become clearer and clearer. We don't have that array yet, but A private marketplace can do that. A government marketplace can't. Please recognize the best beneficiaries of private care are the most sick people among us.